in our country from COVID, and it's alarming. It's just unbelievable that if you look at the total number of deaths that are occurring from COVID-19, it is disproportionately elevated for African American. We're leading the statistics as far as death is concerned. Making up in the state of Illinois, which is pretty much kind of universal or nationwide. We're about 13%, anywhere from about 13 to 14%, give or take, in every state. But average, we're about 13%. But we got the most deaths. We got over 100 deaths of any other people in this state. And if you look at the numbers nationwide, we are dying at a higher rate and more abundantly. And so, a couple thoughts on it. It's just a microcosm of what this country is about. If anything else, I think COVID has exposed what the true issues of our country are. And I'll give you an example and a misconception that we have, and as a physician, it made me really realize some of the statistics that we see from a statistical standpoint. Number one, when you talk about like women dying from childbirth, babies dying, healthcare disparities, if you look across the board, Black people are just dying at a alarming rate more than our counterparts. And hello, everybody. Now I'll answer any questions after this. This is more just me talking, more so, and just giving my thoughts and a little bit of the research that I've come up with, just as far as why these numbers look like this. But anybody can, chime in and talk about some stuff. I'll address it when I'm done. But we talk about like just the healthcare disparities in of themselves, and you look at hypertension, you look at just deaths, you look at diabetes, and a lot of that, the things can be explained when you look at diet and when you look at access to healthcare. But this COVID thing kind of changed the game a little bit, and is going to make the world see what the true problems are and how we need to address it. Because you got to think about it, like we are literally there's a randomized controlled trial going on with our lives right now, right? And I talk about randomized controlled trials all the time. And what randomized controlled trials are basically if you put out anything, like if it's a drug, if it's a device, if it's whatever it is, you have to test it, right? And I'm not saying that COVID is a test, but you can look at it as a test trial that's happening. But if you have like any drug or anything, like you have like a random group of people that get said drug or have said disease or have, use said device, and then you get another group of people that don't, right? They get a placebo, they get something else, right? And then you see what happens, right? Or if you test a drug in Black people, you test a drug in white people, you test a drug in Asian people, or you look at a disease in Black people, you look at a disease in Asian people, you look at a disease in Caucasian people. Like, you see what happens. You see how their bodies react to it. You see how things transpire. You see what goes on with it. And then you make, that's why you say, okay, well, when Black people have hypertension, their bodies respond better to certain drugs or what have you. That's what randomized control trials are. Like, you get data from, people or groups or whatever, how they, respond to whatever the variable is. In this case, the variable was COVID, right? And given all other things, like, nobody's seen this, like nobody's, genotype or body makeup or antibodies have seen this thing that's happening, so it's basically like everybody's being introduced to it. And so in this test, it's like, what's happening? Like how do people respond to it? and black people are dying. So it ain't got nothing to do with the race. Has nothing to do with our genetic makeup. And that's what a lot of things are, people will put it off on, that is being explained as, oh yeah, black people are more prone to hypertension. Black people are more prone to this. But none of this stuff matters at this point. We all are being tested with this virus at this point, and we dying at an alarming rate. So this shows you that this ain't got nothing to do with like healthcare disparity things. This is more of a rudimentary economical level disparity that is happening amongst people, right? And how our government is, and how our country is still rooted in racism, right? Access to resources are lacking, or what have you, and that shows you that in a perfect world, or in a world that's better, that if you put the resources into our communities that are failing and the people that have not, they wouldn't be dying, right? But it's not put on a pedestal. It's not put as one of the things that we need to address. So, I hear people all the time talk about, like, they get on the news and they say, well, why are those people out? Or why are they doing that? Why can't they just stay in the house? How the hell are you going to stay in the house if you can't eat? Like, you got people sitting in penthouses and, got a whole refrigerator full of food and, got months of money stored and saved or what have you, and can easily sit and watch Netflix and play with their kids and are just enjoying this time. But you got people that, man, if they don't go out and drive this Uber, they're not going to eat, right? You got people that, like, if they're not going to a fast food store or going to some of these stores and working, they're not eating. So how the hell can you tell these people to stay in the house, right? So with that being said, you exposing them to the virus, you expose them to the disease, and that has nothing to do with race. That has nothing to do with genetic composition. That's just simply that in this country, we don't value everybody the same. And you can hear Republicans talk about all type of stuff all the time. You can hear conservatives. I won't even say Republicans, because all Republicans are not built the same. So scratch what I just said. But you can hear some conservative thought processes of, like, people got to do for themselves. People got to, grind and do these things for themselves. But, like, when you're not giving people resources, when you take everything away and put everybody, like, just fend for themselves, like, people are dying. Like, you cannot do that. So if anything from this entire fiasco of a pandemic, if anything we gather from this, right, we can't be the same, y'all. Like, real talk. We cannot, like, come up out of this and have life as it was, right? If we do, we're fools, right? If we do, we are completely, complicitly in the destruction of ourselves, right? Because if you're looking at this and you're looking at what's happening and you're looking at people dying and people struggling and people can't stay in their house, can't stay in their house to stay safe, they got to go out just to live. And you okay with that? And when it comes back on, it's just like, all right, keep going back and running a rat race or what have you. Keep allowing, your mayors and your governors or what have you to allocate funds to different places and not, give them to the places that really need it. Right here in Chicago, it's just like, look at the hospitals on the South Side, right? From the hospitals I work at, Ingalls, Mercy, you got Trinity, you got South Shore, you got Roseland, you got all these hospitals that are completely underfunded. That, like, man, if you go in there, it's like they don't have tests, they don't have any of this stuff or what have you. And people are coughing on each other, people are stacking on top of each other. The workers and everybody, the doctors and everybody that's in there is, getting it and bringing it home to their families and their moms and everything. And it's just a circle and a cycle, whether if you got money or if you don't have money, if you're in this environment, you're getting sick and you're dying. Like, if it ain't nothing else that y'all do, I know I talk a lot, man, but I try to do a lot too. But as a people, if it's nothing else that we do to demand our tax money that we spend to be allocated to where it needs to be, we fools. And I don't care what black rights, whoever think, like, I'm not the one that's like, okay, I am, I understand that there is a bias. I understand that, that the way things are set up, and that, yes, it is, the majority and how they got things. So I get it. I understand that. And by no means am I saying, pull our own selves up by our bootstraps. I'm not saying that either, even though many conservatives will say the same thing. I'm not saying that. But I'm saying, as a people, we have to unify and start putting the pressure on, because, like, the next COVID ain't gonna be a COVID. It's gonna be something that's gonna wipe us out. This can get worse. Like, the next time this happens, like, it's more of us that are gonna die. And if it gets too serious, just imagine if this gets to the point where, people got to stay in their house for 4 months or 6 months. This should pass in about, maybe another month or two. I'm estimating. I could be completely wrong, but it should pass in about a month or two, and we should recover and we should get back. But what happens when this happens again and people have to stay in their houses for 6 months or a year? You got people robbing, killing, stealing, and people dying and perishing because we're not doing anything about this, right? We have to take on this as a people and start pushing these politicians and stuff to, like, man, look at our schools, like, run the scenario down. Like, I'm a product of Chicago public schools, right? I've seen, how, my counterparts, when they talk about they high schools or what have you, they got computers, they got all types of stuff, right? My kids are fortunately privileged enough to go to a great Chicago public schools, but I know kids that are further south that are going to these schools. They have nothing. We're talking about kids with web-based learnings or whatever. These kids don't even have computers. They're at home, like, brain cells are just rotting away looking at social media and playing video games. They don't have access to this stuff. So when you have stuff like this, right, and people don't have access to education, what happens when they get older, right? The crime is going to increase. Jobs are going to decrease. And you're going to find this rat race and continue to run this rat race. And the thing about it is, as the more the world technologically advances, if we're not advancing with the world, man, we're going to perish. We're going to perish. And honestly, that's what I have, taken from this entire thing. It's just like, it's just, if we can't wake up from this, man, it is unbelievable what's going to happen to us in the future. I could rant all about it all day, but this is what I had to say. And obviously, yes, there's access to healthcare. There's still healthcare disparities. The hospitals, are underfunded, and people can't get to the hospital. Yes, that is true. All that stuff is true. But why is that? Why is that when we paying taxes? Why is that when you have money for red light, camera red lights, and people getting tickets? Like, every time I go outside, like, my mama getting a ticket on her car, I got to pay, right? They just walk up and down the street just giving tickets out, right? This is revenue for the city. And they're not doing this in all the neighborhoods. There's a lot of the neighborhoods that, that we live in, right? So how you got to pay, people going down and owing $500, $600, $700, $800, $900 in parking tickets and boot fines and all of this stuff. You paying all of this money to the city, and, they doing everything else with this money, then putting it back into your community. That's because we're allowing this to. We don't have a unified voice. We have to have a unified voice from this, man. Because seriously, like, it's pissing me off more than anything. Like, just looking at these statistics, and as a healthcare professional, I'm pissed. Because people asking why. And I'm like, this is why. It's bigger than healthcare. It is us as a people. Now, if we don't start doing that, we're going to perish. And another thing, the last thing I'm going to say is like, there's been a lot of videos about, black excellence out. Like, it's been, this TikTok wave is been going on. It's been I've been in two myself, just highlighting, like, doctors and showing them in their regular habitat and atmosphere, and then, showing them in their professional atmosphere. It's been doctors, it's been lawyers, it's been, nurses, it's been beauticians, it's been all types of stuff or what have you. But I saw something today that pissed me off, and I saw a very prominent, Instagram, with doctors, with black doctors, it's like, oh yeah, it's enough. This is tired. This is whatever. Like, this is done. Like, what? What are we talking about? Like, as much buffoonery as we see on a regular basis, like as much when this COVID stuff comes on and you turn on your TV and the crime and stuff starts picking back up, and every time you look at the news, you're gonna see some black man that look like me getting shot or robbed or getting killed out in the street. You're gonna see that. We're going to return to what's normal soon enough. So in this time where we can't do nothing but sit in the house and watch some good stuff, to see like actually black professionals that are out there. Like, hell, I went to Xavier. I went to the biggest, producers of black doctors in the world. I mean, just the biggest producer of black doctors in the country. Now, hell, I didn't even know it was this many black doctors out here that are going to predominantly white institutions or what have you, and are out here in these streets doing great stuff. Like, it's like, why are we getting tired of that? I could watch TikTok videos of black professionals all day long. So don't stifle that. Straight up and down. Do not stifle that. Why? Like, as much as black people want to, show themselves and be excellent, like, man, that's what we need to be highlighting during this time. Don't stifle it. That pisses me off more than anything, man. Like, seriously, let it go. Let it play. Right? What is it going to harm for your 10-year-old, 11-year-old, 12-year-old kid to see, black excellence on social media? They're on social media anyway. What would you rather them do? Look on the news and seeing somebody getting shot up, right? Or seeing somebody doing something stupid, or watching us pay, entertainers rapping about garbage? Like, for real, like, what y'all want? Like, man, if I hear another person say something like, oh man, I'm just tired of seeing these black doctors or black, are you a fool? Like, seriously, like, man, wake up. Like, I can't see it enough. Like, for real, everybody that's out there doing something positive, man, highlight it. It don't get old. I don't care if you got 3 views or 4 views. Like, man, every time my kids, if they look at my social media or they look at something on social media, I want them to see that, because they don't see this any other time, y'all, for real. Like, once this is all over and they start looking at regular TV and stuff or whatever, they not gonna see that. They don't see me. They don't see Pulse of Perseverance. They don't see these, hundreds and thousands of black doctors and lawyers and engineers and all that stuff. They don't see that stuff. It's never highlighted. We're forced to actually look at it for once. Shut up and watch it and benefit and help the next generation. And more importantly, straight up and down, y'all ain't nothing else I'll say. Man, as we speak right now, if we're not trying to move as a unit, as a people, to try to make some changes out here, we fools. We are fools. This shows us completely what the structure of our society is and what the nation thinks about us as a people. Because this pandemic is specifically targeting disproportionately a group of people, and nothing is being done about it. You got 13% of people that have death rates that are 3-4 times anybody else, and it's not an emergency? What? It's not an emergency? This is not a thing of resources where Roseland Hospital is getting, thousands of dollars, where Ingalls Hospital is not getting thousands of dollars. People in there on vents right now that are dying on their deathbed, and no money is getting fuel to them. However, I guarantee you, we go up north, it's not that. It's different. It's different. And it's garbage. It's trash. So, all right. Woosah. I'm done. Certain stuff pisses me off, and I have to vent about it and let it go. I've let it go. I said my piece. I'm going to keep fighting my fight. But, wake up, people. Straight up. Straight up. If you don't wake up no other time, if you can't wake up any other time, open your eyes and see what's going on around you, and see what's happening. I know there's probably a trillion different comments. I'll probably answer those, later. Ain't no questions, because I'm just ranting at this point. But hopefully I've given some food for thought to folks. And it's like, again, it's not like it hasn't been done. How have we progressed as a people? The reason we progressed as a people was because our parents and our grandparents, they said enough, right? You talk about civil rights. right? Even you go back with Reconstruction, where we got tore down, right? Like, you talk about movements where black people got together and said, we've had enough. We've had enough. We're not buying your stuff. We're boycotting this. We boycotting that. We're not putting our money into this until you do better. Where's that now? Like, we got comfortable. We getting laxed. We past lax. Like, all of the stuff they died for and got beat up for and hosed up for and dogs biting them, and everything else. All that stuff that happened to our parents and our grandparents is going in vain. It's like it's gotten us to a level and we plateauing at that level because now it's every person for themselves. And it's like, what is my family doing? What is, my close friends and relatives, what we doing? We have to unify and have a unified voice to actually start pushing these agendas. And that goes for black doctors, black lawyers, it starts with the professionals. Real talk. So, and that I'm not going to let us off the hook either. So while we doing all these damn TikTok videos and showing everybody that we got nice white coats and all that stuff, whatever, we ain't talking either. We not the money in our communities. We not, coalescing to improve the rest of us. It's a shame that we not talking. It's a shame to hell that I didn't know it was all of these black doctors and stuff out here. We have to connect too. So if anything, this COVID, this whole thing this pandemic should have allowed us to see like who's out there, where everybody's at, and now what are we gonna do about it? You see who the people out here or whatever. Let's link, let's move, let's make this a better place, man. Let's make it better for ourselves, because ain't nobody else gonna do it for us. If we don't do it, ain't nobody else gonna do it. Promise you that. Like, trust me. There's a conservative movement to keep it right where it's at. And that don't make Democrats or liberals no better, because that's a whole movement, that we think might be completely for us, but it's really not, at the end of the day. Some things, yes, but a lot of things it's not. So, I'm not saying, oh yeah, well, don't be Republican or gotta be Democrat. I'm not saying that at all. I'm saying that we have to look out for we or us. And if we don't, trust me, nobody else will. We got a black mayor, so what? We got a black president, so what? That don't mean they have to allocate the funds to where they need to be, because it's the powers that be that are putting their clamps on them so where they can't allocate them funds. But when we as the people start making the movement to force their hand, how do we force their hand? Hell, don't go to Walmart for a day or 2 days, or don't start not using stuff for 2 days. This is boycotts. It's been proven to us in the past how it works, how it's done. How do you make people make movements? How do you make people create the change? Or how do you create the change that you want for your life? You force it. You change. You don't have to change people. You make the change and they will adjust. You make the change, they will adjust. Fine. You don't want to you don't want to give money to our schools. You don't want to do that or whatever. We ain't going to drive today. We ain't going to use gas today. We're not going to that Walmart. We're not going to those businesses. We're not doing any of that stuff. Watch their money fall. And watch their money fall, then watch what happens. Things start changing. All right. I'm done. Love y'all. Have a good week. I'm gonna keep grinding, keep working. Y'all be safe, man. Still, it's a pandemic, so stay in the house. Keep your mask, wash your hands, all of the above. It ain't changing. Hopefully it's over soon, but until then, y'all be safe. God bless. Good night.